My name is McLaughlin from the University of Western Australia. I'm part of the Optical and Biomedical Engineering Lab, and we're winners of the 2014 SPIE Startup Challenge. And so what I've got here is it's a microscope-in-a-needle. It's a tiny miniaturized fibre optic probe that takes OCT images. But what's special about it is it's so small. We can insert this into tissue and take high resolution of images in tissue deep down, as deep as you can insert a needle. So a classic problem you get with optical imaging modalities is they don't penetrate into tissue very far. OCT typically is between 1 and 3 millimetres. And similarly we can only see maybe about 1, maybe 2 millimetres. But what's exciting is that we can see from the tip of the needle and we can put the needle wherever we like. So if we need to see somewhere deep in the body, as long as we put the needle there, we can actually still see that regardless of where that is. So one of the applications we're doing a lot of work on is breast cancer surgery. There's a problem that breast cancer surgeons have is that they know where the tumour is, but they need to know where it stops. So we're looking at whether we can use this probe during surgery to test and find the edge of the tumour. But we're also working on a number of other applications. In brain surgery, one of the issues you have is when you take a biopsy, if you hit a vessel, that can kill the patient. So we've built one of our probes into a biopsy needle so that as it goes in, we can actually look out from the biopsy needle and see if there's a blood vessel there which may in danger. And we've actually just the other week got our first in vivo scans, our first preclinical in vivo scans, and the images look pretty good. One of the other things we've done recently is we've taken one of these microscopes in a needle and made it dual modality, so it can take both an OCT image and a fluorescence image. Now that suddenly opens up a really exciting world. There are fluorescently labelled antibodies that bind to specific types of cells, like cancer cells. And what we've now got is a probe that can see that and see that deep inside the body. So for us, the really exciting thing that's happened this year is we've taken that probe, we've made it sensitive enough that we can see the fluorescence from just tiny clumps of cells. So tiny levels of fluorescence, and we can see that all with a probe that's this size. We're really lucky. We've got a great team. We've got a range of people going from optical engineers to software engineers to people who are good at the mechanics and the electronics. One of the things that we do, because we build clinical prototypes, is we go right from basic science through to something that we can take across to the hospital. So we build entire OCT scanners, and then we focus on really building these type of fibre optic probes well. And to put all that together, it takes an incredible team of engineers. One of the things I think that we've been really lucky about is we've managed to keep the same team and grow it over several years. So these people have really built up expertise of how do you make real prototypes. One of the issues you have in biomedical applications in optics is it's fine for it to work in the optics lab, but if you take that over to a hospital, to a surgical suite, it's a very different environment. It's noisy, it's loud, it vibrates a lot, it has blood around. So what we've learnt over the last sort of 5 years is how to make prototype systems that are portable, that we can take over the hospital and are going to work in that environment as well. So doing this sort of work, especially in the early stages, funding makes all the difference. We've had an incredible amount of support from the charities, from the Cancer Council of Western Australia and the National Breast Cancer Foundation, and they've really helped propel this to a point that we can get that into hospitals. At the university that I'm at, the University of Western Australia, we also have a medical school, and we have major hospitals in the city as well. So we work with 3 of the major hospitals in that city. We work with the breast cancer surgeons in there, but also even on the medical side, it's a whole team. It's the surgeons, it's the radiologists, it's the pathologists, and you need to work with all these people as an engineer if you're going to make a biomedical application work. One of the things that I love as an engineer is working with doctors. Great thing about doctors is they keep you honest. So surgeons, if what you're inventing can't help them do their surgery better, then they've got no time for you. So they tend to keep you really, really focused. And we've had a lot of feedback from the surgeons. Because we're really listening to what they need and trying to do something that solves their problems, we also get a lot of support from them. So the surgeons we work with, people like Christabel Saunders, who's one of the leading breast cancer surgeons in Australia, has opened incredible doors to get us access to patients and human tissue so we can actually test out the sort of probes. But for us, it's all about making sure what we're doing is useful to the doctor. Now that our probes are stabilising, is this year we're looking at doing a number of trials on human tissue to really understand just how good this stuff is. Our intention is to spin this out into a company in about 1 year's time. One of the things we're well aware of is there's a difference in translating research from the research lab into private industry. When you're in the research lab, you have the time to explore all the details. Once you get that to spin out, it's really about turning out product. So this year there's some aspects of the technology we really want to bed down, and then in a year's time we'll be looking for investment so that we can spin that out and get that into hospitals.